Hi, Rebecca, how you doing today?
I'm okay.
You okay?
Mm-hmm.
I understand recently you had a difficult experience, and that's what brought you into the clinic.
Yeah, actually I did about 9 days ago. We
Mhm.
own a horse farm, and my family does. And my sister and I were loading a horse to take to a horse show. And the horse she's pretty young, and she'd only been loaded a few times. So my sister was in the horse trailer with the horse, getting her loaded and getting her tied up, and all of a sudden the horse just totally freaked out. And she started really thrashing around the trailer, kind of throwing my sister around. She got really banged up. She's okay now, and the horse ended up escaping back out of the horse trailer. But I was just really, I mean, that's happened before, because when you work with horses, things happen. So I thought I was kind of used to those types of things, but just this particular incident, I can't get rid of the thoughts of it, and it was just really scared me.
Yeah, it sounds like a scary experience.
Mm-hmm.
So your sister's injured by the horse, she's okay.
Mm-hmm.
But you've had things like this happen before, but this is different.
Yeah, this is different. Like I'm having trouble sleeping at night.
Mm-hmm.
I wake up from like recurring dreams about the incident.
Okay, so you're dreaming about
Mm-hmm. Yeah.
the accident?
Yeah.
Mm.
I pretty much work on a horse farm, so I'm surrounded by horses, and just the slightest little noise they make, I just almost jump out of my skin and turn around, and I'm just, having a hard time even like handling them. I'm just real short with people, and yeah.
So your work experience has become unpleasant.
Yes.
Yeah.
Yeah.
So you're more aware of the horses, and you're more startled by what they do now?
Yeah, definitely.
You noticed
Yeah.
a change there?
Yeah, even just little things when, they're just whinnying, or just kind of when they're tied up and they're just maybe roughhousing a little bit, like it really kind of freaks me out.
Have you been having difficulty concentrating?
Yeah, actually I have, because I'll start a task, and all of a sudden I'll just be thinking about, I'm not trying to think about what happened or anything, but my mind just goes to the memories and just kind of replays it for me, and I have a really hard time staying on task and staying focused.
So the memories seem to be coming back automatically.
Mm-hmm. Yeah.
You're more aware of your surroundings there as you're working.
Yes, I'm very much aware.
Have you had any positive emotions? So you said this happened 9 days ago.
Mm-hmm.
When did the symptoms start?
They pretty much the next day. Like, I think, that day I was just kind of trying to recover from the incident, and then by the next day, I had a really hard time being around the horses, and just the thoughts coming in, and yeah, it was definitely pretty much the next day.
So the next day.
Yeah.
So from that day, from a day after the
Mm-hmm.
accident, have you had any positive emotions?
Not really.
No?
No. Mm-mm. No, I've just...
It's been tough for you since then?
Yeah, just kind of been fearful, and just kind of upset that I can't kind of shake this, because, I work around horses.
It's happened
and
to you
stuff.
before.
Yeah. I should be able to get over it. I don't know. So I'm kind of mad about it too.
This time's been a bit different. That's
Yeah.
upsetting.
Mm-hmm.
Have you had your memory of what happened compromised at all? Like, you feel like you're missing pieces of what happened?
I don't think so.
You remember pretty well?
Yeah, I think I remember pretty well.
Have you had any experiences where you had this sense that your surroundings were altered, kind of like unreal, anything like that?
Not really necessarily, except maybe like when the memories come and stuff. I think they really hit me, strongly. But
All right. How about any episodes where you feel like you're reliving the the accident. So not just an intrusive memory, but actually like you're reliving it, like you're back in that moment. Anything like that?
I think it's mostly just the memories.
Memories? Okay.
Mhm.
So I want to try to understand what may be going on.
Mhm.
So I'm going to ask you a few questions that may not seem like they match well with what you're talking about, but it's important I check these things out.
Okay.
Right. Do you have any medical problems?
No.
No. Have you had any recent use of alcohol or drugs?
No.
Nothing like that?
No.
All right. Rebecca, I'm going to get you in to see a counselor.
Okay.
I appreciate you spending this time with me and answering these questions and telling me what happened. It was helpful.
Okay.